Let's take a look at atherosclerosis, which is a possible preventable disease of the circulatory system. So atherosclerosis, what is that exactly? Atherosclerosis is a thickening and narrowing of arteries due to plaque formation. You may know that the arteries carry oxygenated blood away from the heart toward the rest of the body. It is therefore a big problem when arteries can't function correctly and provide blood, including nutrients and oxygen, to meet the needs of the body. This can be life-threatening. So plaque, which is made up of fat, cholesterol, and calcium to name a few, blocks the normal movement of blood. You can see this here when you compare a normal artery to an artery that is obstructed by plaque buildup. Why does this plaque form in the circulatory system? First, the blood vessel, the artery, becomes damaged by things like high blood pressure, high LDL cholesterol, or toxins. This specifically damages the inner wall of the artery as shown here. What happens next is that cells of your immune system, as well as other substances such as fat, cholesterol, calcium, platelets, which are involved in blood clotting, and cellular waste all accumulate and form the plaque. The plaque may even rupture and cause a blood clot. Is this plaque even harmful? Is atherosclerosis a serious disease? Well, to answer that question, I'm going to take you through several diseases that can develop from atherosclerosis. First, we will look at the brain. We can all agree that the brain is one of the most important organs of the body. Now, if you have plaque buildup in the arteries that lead to the brain, such as the inner carotid artery, the brain will not receive sufficient blood supply to maintain its functions. This is known as cerebral ischemia and can lead to a stroke. Next, we will look at the heart. You may know that the heart is a muscle that pumps blood throughout the body, but it also needs blood itself to function. Blood must enter through the coronary arteries to supply the heart cells. As you can see in this animation, plaques can also form in these coronary arteries, preventing blood from reaching heart cells. This may cause myocardial infarction, also known as the infamous heart attack. The heart muscles can't work properly without proper blood supply. Next, blockage of blood flow to the kidneys can also be problematic, as the kidneys are very important in removing waste from the blood and is an important regulator of blood pressure. Plaques can also form in arteries leading to the arms or legs, which can cause cramping as the muscles get less blood. So as you can see, atherosclerosis can cause a plethora of other diseases and needs to be taken seriously. Are you at risk for developing atherosclerosis? There are several risk factors for developing this disease, some more better predictors than others. A bad diet, such as one high in bad cholesterol and saturated fats, has been shown to lead to increased plaque formation. Smoking also increases the risk. As I said previously, high blood pressure can lead to atherosclerosis as well as many other cardiovascular-related diseases. Other risk factors include diabetes and decreased physical activity, which can be attributed to aging. As you age, you are at a significantly higher risk of developing atherosclerosis. A non-controllable risk factor for the disease is genetics. It can be hereditary. If you can remember from the beginning of this video, I said that this disease is preventable. A lot of the risk factors are controllable to an extent. If you eat a healthy diet, low in saturated fats and cholesterol, exercise regularly, try to live a stress-free lifestyle, and stop smoking, the risk of getting atherosclerosis will drop. A change in lifestyle will lower your risk for this disease as well as numerous others. If you were to have atherosclerosis, would this be treatable? Science and medicine have come a long way, and there are various drugs and other therapies that can both prevent atherosclerosis from occurring in high-risk individuals, or help remove or decrease the plaque that is disrupting the flow of blood. There are also surgeries available to those patients whose atherosclerosis have a higher likelihood of causing further disease. This includes angioplasty and a bypass graft. The administration of therapy is a multifactorial decision made by the doctor. So to summarize this video, plaque can cause blockage of blood flow to parts of the body. This can be potentially serious as they can cause other cardiovascular disease. There are many predictors of atherosclerosis, and the risk of atherosclerosis only gets worse as you age. However, the risk of disease can be decreased by making certain lifestyle changes. And lastly, atherosclerosis can be managed therapeutically by doctors. And now you know a bit about atherosclerosis.